Hello, I'm Kathy from Senior Care Corner, here to share another family caregiver tip. Today's tip, caring for our dentures. Many of our seniors have dentures and we want to be sure that they're in good repair and they're being properly cleaned to prevent any problems with mouth pain or difficulty chewing that could lead to poor health. And also as family caregivers, we may be the ones cleaning the dentures, so today we're going to share some tips on how we can do that. The first thing we want to remember about dentures is we need to keep them clean just the same way we keep our natural teeth clean, and that is by cleansing them daily. First thing you want to do is take your dentures and put them under some running water just to remove the food debris. It's a good idea to remind our seniors to take their teeth out after every time that they eat and rinse them off to keep any food particles from getting caught inside the plate and actually rubbing a sore on their gums. That'd be very painful and lead to problems. So go ahead and rinse them off. Once you've gotten them rinsed off, you want to use a soft bristle toothbrush, nothing special, denture brush if you have it. Rinse off the food, brush it off, get the food plaque off from inside and out. Remember, we're not using regular toothpaste on our dentures because toothpaste is a little bit too abrasive for our dentures and they could cause them to scratch. Also, let's not use hot water on dentures. It could cause them to warp. Don't use bleach on your dentures either if you see some stains that you think you can remove with bleach. That's very harmful to our dentures. We just want to soak them in denture cleanser and that'll get them clean. Another idea is make sure that your senior has a dedicated denture cup to keep their dentures in overnight or when they're not in their mouth so that they don't lose them, break them, or any mishaps happen to them. Also, it's a good place to keep them clean, get them cleaned at night. A good tip is to use a towel or a washcloth over your sink or countertop while you're cleaning your dentures. They could get a little slippery when you clean them and fall down. If they fall on the sink or the floor, they could break or crack, and that's not what we want. If your senior's dentures are a little loose, you may want to use some adhesive inside the denture plate, and that's fine. Don't use too much adhesive. And be sure that you're cleaning out that denture adhesive every day. Soak them overnight. Another thing to remember is just because their senior doesn't have teeth anymore, we need to still keep our mouth clean. Use a brush and brush the gums, the tongue, and the upper part of the mouth just to keep it, again, free from debris, food plaque, and particles, and keep them from having mouth sores. It's a good idea to remember that the better we care for our teeth, the better we care for our seniors' health. We hope you enjoyed this family caregiver tip and invite you to stop by Senior Care Corner for more tips and information for caregivers. See you next time.